what is the sacroiliac joint and where is it? I've just got a model here in front of me, and what we're looking at is at the bottom of the spine you have the sacrum, and where the sacrum meets the ilia, which is the pelvis, we have the sacroiliac joint. There is one on the left hand side and there's one on the right hand side, so you have one each side here. They cushion or articulate with the pelvis itself and are responsible for allowing movement at the pelvic area. Without these two joints and the pubic symphysis at the front, long levers of the body, which is the spine, and the two legs that attach from the hips here and go downwards, those torsional forces that would be presented upon the pelvis would likely shatter the pelvis. So functionality wise, the sacroiliac joint has to allow movement at these two joints. The problem occurs is when they go wrong, and a lot of people will have their own diagnosis about what actually goes wrong in there. So we've launched a website now into support of this called sacroiliacjointpain.co.uk. Now, who are our patients? Our patients are people who come from all over the UK. They're local patients. We even get patients from Europe who actually travel a long way. So this indicates to us that this is not a local problem. This is not something that is very small. This is a massive problem, and it's worldwide. So what we try to do is to try and resolve a lot of people who have got long-standing sacroiliac joint pain problems, and hopefully we can try and do something about that. So, why are we unique? What does Atlas Pain Relief Centre provide that other people don't provide? Myself as a clinical director, I'm a fellow sufferer of sacroiliitis or sacroiliac joint pain. Many years ago I was suffering with this, and my training as an osteopath and a physiotherapist didn't give me the skills. It gave me the skills to work on dysfunction, but it didn't give me the skills to be able to resolve issues. Many people that used to come into our clinic used to have problems with pain in the area of the sacroiliac joint, but never really had any dysfunction. There was nothing wrong. So if there was nothing to fix, how are you going to fix it? So I set about trying to resolve this personal issue that I had and say, okay, there's a problem here. I need to be able to solve it. My training never gave me those skills, unfortunately. If there was a dysfunction, if there was a twisted pelvis, rotated ilia, biomechanical problem, I could deal with it. But if on presentation everything was clear, yet they still had the pain, I was a bit of a loss to what to do. So I spent 2 years researching this particular problem, trying different things, different techniques on myself to be able to resolve it. And hallelujah, I came up with a result. We now have a system now that works within the Atlas Pain Relief Centre, where myself and my practitioners that work here have a treatment plan if you have sacroiliac joint pain that seems to be resolved within 2 to 3 weeks, twice a week for 2 or 3 weeks, which is between 4 and 6 treatments. Normally most people are fixed in 4 treatments and pain-free. Other people might take 6. But 80–90% of people are actually resolved in those particular periods of time. A lot of patients now that are visiting us have been through the system, the NHS system, the private system, where they've eventually ended up in the pain clinics. Okay, the pain clinics are doing things like denervation, which is nerve denervation. They're having nerve root blocks, epidurals. They're having facet joint injections. They're having prolotherapy. They're having all sorts of things done to them, and heaven forbid, some people have even suggested that they were thinking about having fusion of the sacroiliac joints. When they've had a lot of these things done, they've still not had the problem resolved. So the answer really is in the diagnosis, an accurate diagnosis about what your particular problem is. Once that's been done, obviously it's a matter of trying to find out, once the problem has been solved, what it is we can do. If you have sacroiliac joint pain, give us a ring. Telephone number 01827 59943. Thank you.